Well, good morning, everybody, and welcome. Thank you so much for taking the time out of your busy schedules, doing the most important work that can be done in the Commonwealth, most important work that can be done by any state agency, any organization, anywhere. So I'm going to say this every time I get a chance to be in front of you. I'm going to say thank you. Thank you for what you do every single day. Are literally changing the lives of millions of people in Virginia. You know, our mission is the most important mission. What's our mission? People helping people triumph over poverty, abuse, and neglect to shape strong futures for themselves, their families, and their communities, right? So, to me, it means putting food on the table, being able to pay your housing costs, helping you live a life of dignity, and an important part of that is having health care, right? It's a right. It's a basic right that we have. And today is, there's some days that are tough days, right? We all have tough days. There's problems. The to-do list is too long. My kid is sick at home, and I'm here trying to figure that out. But today is a day that we can celebrate, and I love those days that we can celebrate what's great. And what's great is in Virginia, we've got the opportunity before us, starting very soon, to cover 400,000 more people with Medicaid. Let's hear a big round of applause for that. I mean, in one fell swoop, we now can accelerate our mission that much faster, that many more people. And when I tell you that we are at an amazing point in history and you get to be part of it, literally, you're making history not just for the Commonwealth as a whole, for the papers and the political pundits, right? Forget all of that. You're making a difference in the history of the lives of millions of Virginians, because those 400,000 people, they're part of a family, they're part of a workplace, they're part of a friend network, right? We can all think about times personally, in our own families, in our own lives, where having just basic healthcare access was a game changer. Right? It was literally a game changer. It's changing history because we're changing the trajectory and history of those individuals and those families, right? I mean, literally having health care can turn everything around for somebody. And so today we're here, one, to celebrate, which is really important. Two, to learn about why it's so important, how it's going to work, what the Department of Social Services is doing, and most importantly, for all to think about what each of us as individuals can do. So we are this big, diverse agency, right? I mean, we do lots of different things: child support, licensing, child care, SNAP, child welfare services, right? Very diverse enterprise. But I want everyone to think about, in your role at work, what is it that you can do, the program, the service, the technology, what is it that each of us are doing that we can find a way to support this effort? And there might be a place where there's no direct thing that you can do at work, but guess what? We're part of a family, and we're here to support each other. So all those folks that work with Tony Washington and benefit programs and Dottie, right, and information systems. So Deborah, raise your hand, Deborah. Is Sherry here? I don't know if Sherry here is. Tony, right? So bring them a cup of coffee. Go apple picking on the weekend and bring them an apple and put it on their desk, right? When they're dragging on the elevator, give them a little pep talk. So we can at least be here to support one another. And the other thing is, we all have lives outside of here, right? I know from my interaction with you that each one of you are leaders, right? The one thing that I learned a long time ago is that leadership is action. It is not position, right? Leadership is action. You are leaders in your communities, in your churches. I bet there's some social media stars out here that we don't even know about, right? Or I don't know about. So find a way to be a leader, to help get the word out, to help educate folks, because it is going to be there, right? That benefit's going to be there, but if folks don't sign up for it and don't get it, it doesn't matter, right? So we want to find everybody in every community whose history we can change together. So think about that personally, professionally, and then there's a couple folks here today that are our partners you don't see walking around the building very much. One of them is Gina Boyle-Berger. Gina, I'm going to make you stand up. Actually, Gina, come stand in front of the camera. Here we go, so they can see you now that I know that got the camera thing. Say hello. So Gina is our deputy secretary at HHR, and she's my deputy secretary. I get to claim her. She might get to deny me, but I get to claim her. And when I tell you how lucky we are to have the deputy secretary, Berger Boyle, she is hardworking, she is smart, and she's got a big heart, right? And she knows this business. She's been around. And she is our champion. She is our advocate every single day in the governor's office, in the secretary's office, with stakeholders in the community. And we are really lucky to have her. Let's give her a big round of applause. And then, you know, we've got the best way to describe it is just Team DMAS, all right? So the Department of Medical Assistance Services, they are our sister, brother, cousin agency, whatever analogy you want to make. So they're the cognizant state agency over Medicaid, right? And so they're in charge of it. And we support them by running the eligibility function as part of that. And that partnership together is what makes Medicaid happen, what makes healthcare happen, what changes history in Virginia. And I have really enjoyed over the last 10 months reacquainting myself with some of the folks that I worked with way back when I had hair and worked here, as my children were reminding me this weekend. Children are brutal, aren't they? So, and then I've gotten to know Dr. Lee, the head of DMAS, over the last 10 months. And I feel this spirit of partnership and collaboration and working together. To me, it feels like they are just as much part of our agency as anybody else. And I'm profoundly grateful for their leadership and their work. And I'm going to do a little intro of Dr. Lee and then sort of turn it over to her. But Dr. Lee is this amazing sort of national leader in healthcare, but has really started with her being a physician and working, you know, as a leader in emergency rooms up in Northern Virginia. So, you know, she has lived it and seen it. You know, she's not like me. I just talk about healthcare. You wouldn't even want me to put a Band-Aid on you. So she's a former assistant professor of emergency medicine at George Washington University School of Medicine and Health Sciences. She served under the McAuliffe administration as deputy secretary in the same role that Gina has. She's had an appointment at the Milken Institute for Public Health. She's directed emergency medicine health policy fellowship program there. She was a White House fellow in the office of Secretary Shinseki at the Department of Veterans Affairs. She was principal deputy undersecretary for health at the Veteran Affairs Administration. I could sort of go on and on. But what you need to know is Dr. Lee is an amazing leader. She's got great vision. great management. So I have coffee with her and ask her what I should be doing. So she gives me really good advice. So anything good that I'm doing, it's really because probably Dr. Lee has whispered in my ear. And just a great partner and a great friend, and she's got a really good sense of humor. So, I mean, what more could you ask for? So I'm going to turn it over to my partner and friend, Dr. Lee.
Thank you. Thanks, Duke. Thank you so much, Commissioner Storin. And thank you all so much for gathering here. You know, as your commissioner said it, I couldn't have said it any better. We are at this truly historic moment in time, at the cusp of the greatest expansion in healthcare coverage that our state, Virginia, has ever seen. And we together, we get to make it happen. We get to make it a reality for 400,000 people who really, really need it. So it's something that I think about every moment of every day, and I'm so very grateful for this opportunity, and I'm so grateful to be part of a team working alongside your commissioner. You know, Duke was joking that he gets ideas from me. I actually get a lot of ideas from him. You know, when we have our agency head meetings that our Deputy Secretary Gina coordinates for us, we oftentimes go around and share what's happening at our respective agencies. And whenever Duke shares what's happening here at DSS, a lot of us turn to each other and we're like, why didn't we think of that? We should be doing that too. We're taking notes and bring the ideas back home. So I feel incredibly lucky to be able to work in partnership with him, with the commissioner who's become my good friend. And I'll just say that I think DSS is very, very fortunate to have Commissioner Storin at the helm at this time and leading such an important mission for the whole state. So I just want to give him a hand. You know, thank you, Commissioner, for your leadership. And, you know, this past summer, we actually had the commissioner over at DMAS. So Duke came with Tony and several other members of the team, and we had a packed house similar to this back at DMAS and learned about the important work that you do. And it was incredibly helpful, and I heard a lot of feedback afterwards, positive feedback. The general theme was, oh my God, I didn't know how much DSS really does, how large the mission and portfolio is, and it's complicated, you know, and it's big and it's important. That was really the feedback all of us were hearing at DMAS afterwards, and I'm really glad we had an opportunity to learn from the commissioner about your important daily work. It includes, but it really goes beyond Medicaid, and I just want to thank each and every one of you for the work that you do every single day on your mission, lifting families out of poverty. You know, healthcare is absolutely only one slice of that. It's an important piece, but it's only one small piece. And I know that because I've seen many patients come into the ER for what seems to be a health emergency, but is really related to a myriad of other factors that they're dealing with. So they don't have housing, and they lost their job, and you know they're dealing with substance use and other issues that, you know, it's just there's so many pressing stressors, social stressors on them, and they come to the ER, you know, for health care, but many times we often think as the healthcare team, what they really need is much more than that. They need a pathway to employment and opportunity and stable housing, and those things are the critical ingredients you need to actually be healthy and well. You can't do one without the other. So it's all part of one whole fabric of supports that we get to work on together, and it's truly, I think, a blessing that we get to do that. I also want to introduce members of my team who have accompanied me here today. So there are a few right here in the audience in the front. So Linda Nablo is our former chief deputy who had the shortest retirement in history at DMAS. She retired and came back. We actually strongly encouraged her to come back once we knew we were going to be implementing Medicaid expansion, and gratefully she came back, was hired back by the governor's office to support us in that jointly. So thank you, Linda. She's back. We have Cindy Olson, who many of you may know as our chief guru, our division director of eligibility and enrollment. All the hard questions, please direct to Cindy, because she has an encyclopedic knowledge, truly it's the case, of all of the very complicated eligibility rules, and we're very thankful for her leadership. We have Miriam Siddiqui in the back, who's also our part of eligibility enrollment, our senior program advisor, and Joanna Fowler next to her, who is our in my office as a special assistant. And Joanna and Miriam are part of two members of a three-person, what we call Tiger team, that's working on Medicaid expansion, sort of a project management team back at DMAS. And also we have our technology team here, and Rebecca Dooley, who's supporting with communication. So we have a large team, and every day our teams get to work together. Tony, Deborah, Dottie, and so many other leaders here at DSS. And every single day I hear, again, how wonderful feedback about the partnership, the great collaboration that our agencies have together. And I just thank you so much for your hard work, both our teams, really, every single day to make this happen. It has been a busy, busy summer, but we're going to get there, and we're so excited for what it will mean for our Virginians. So thank you for that. I am just going to take a little bit of time to talk about what this means. So if we could advance sort of 2 slides. Let's see here. Oh, sorry. Okay. Well, in the meantime, I'm just going to thank more people, because it is a time of celebration too. We just got a key approval back from the federal government. Oh, thank you. Thanks, Steve. Oh, I'm so sorry. No, he's got it. Okay. From the federal government on a key piece of this, which again, you all own this for us, the eligibility approval that we needed to actually open up our Medicaid program to the 400,000 people. And we couldn't have done that without the support of our teams and policy working on that every single day, but also our secretary. We have 2 fantastic deputy secretaries. You met Gina earlier, and her colleague Marvin, who's our deputy at DMAS, and we all get to work together every day on moving this big project forward. And so it's a wonderful team effort, and I'm just very grateful to Gina, to you, and to the secretary for the support. So moving forward, so I wanted to, let's see here. Is that nope. Can you advance 2 slides? One more? There we go. Okay. So I wanted to start by sharing a little bit about a summer road trip that I took about 4 years ago. So this is a picture from the event. This was an event that happened in July of 2014. It was down in southwest Virginia, down in Wise County, and actually was held at the Wise County Fairgrounds. And you see folks waiting in great anticipation for the event to start. And, we also were very excited. I went with a colleague and a friend at the time to be a part of this event. And it was a long road trip. It's about 6 hours to get down there. And when we got there, we saw, of course, there were people early in the morning sitting and lined up waiting for the big event to start. But actually what we had heard is that not only were people very eager and waiting in the stands for the event, but they had come the night before and even all the previous day and lined up all through the night and actually parked and slept in their cars waiting in anticipation to get in, because only about 2,000 people were going to be allowed into the event. So they were giving tickets out, and everybody got a ticket who lined up in time, and then just slept in their cars. the day was actually a little bit, it was hot and then it got colder the next day, but, it's July and it was outside, so it's not the most comfortable, kind of setting. But people were, of course, very, as I've shared, very motivated to be there, to be a part of this. And there were about 2,000 people who got in, and some people who were turned away because they just didn't make the cut, didn't get a ticket in the first of the first 2,000. And so, you wonder, well, okay, what is this event? Was it a concert? Was it a sporting event? What was it at the Wise County Fairgrounds that they were so eager to get to, that they had traveled for miles and miles and miles and hours to be at, sleeping in their cars overnight to have access to? And what it is probably not what you would expect, but they were actually waiting for the opportunity to get free health care and dental care. And what the event is called is the Remote Area Medical Clinic, and it's happened for the last 18 years, once a year in this area in Wise at the fairgrounds. And it is the equivalent of a free clinic that is held throughout the weekend and offers a variety of different services, again, only to those who are fortunate enough to get a ticket to be able to get in and access that care. And so, again, thousands of Virginians sleeping in their cars waiting for this care because, as you can imagine, they don't have any other way to get it. And what was I doing there, and what do they actually get when they get in to be seen, is not the kind of care that you or I would really want, frankly. So I was volunteering at the medical clinic, so to speak, which I'll show you a picture of. No, it's working. Great. So this is the medical clinic. This is a horse barn at the Wise County Fairgrounds. It's literally a barn with stalls where we threw sheets up and put some numbers up, and those were the patient rooms. There is no air conditioning. There are no doors to keep things clean. It's literally a kind of a barn stall. And this is where we saw people, and the types of patients that we saw that day. I saw a 30-something-year-old woman who had come in because she had terrible dental pain. A lot of folks come into the RAM clinic because they're in great need of dental care and they can't get it. And she had every single tooth in her mouth extracted, a full mouth extraction. At the age of, I think she was 31. And when I saw her in the medical clinic for some medical issues she was also experiencing, she was so happy, blood dripping out of her mouth. So why, how are you feeling? I'm so happy I'm finally out of pain. I've been in pain all year, waiting for this day to pull every single tooth out of her mouth. And she was not the youngest. There were teenagers getting all the teeth pulled out of their mouth because it was so painful for them. I saw another woman who was a little bit older who had congestive heart failure, who came in short of breath. We sat her on one of those gurneys and tried to give her a breathing treatment and listened, and she was just wheezing throughout. And it was really hard to treat someone in this setting. It's not ideal. It's not the kind of place that we need to be treating somebody who's in need of help and who's having an acute congestive heart failure exacerbation. And it just struck me at that time. I mean, this is what Virginians are getting. These are our neighbors, our friends, our family in our state. We are the richest country in the world, and Virginia is one of the top 10 richest states in the nation. And thousands of people are sleeping in their cars because they want to be seen in a barn stall. I don't get it. Something is really, really wrong with this picture. Something is really wrong. So fast forward a couple years, and actually this past summer, we came into the role in January and shared this story with folks at our agency staff at DMAS, and a lot of folks after came to me and said, "We really want to go volunteer at the RAM clinic. Can we go? Can we go volunteer? We want to serve. These are the people we really want to serve." And so we took a team, about 23 of us, went down to the RAM clinic this past year in July. And this time it was actually raining. It was raining all summer this year, but it was raining there. And we got there, and there were still quite a few people. There were a lot of people. What we heard, and people camped out, cars and tents. When people woke up, they were up to their knees in water when they had been camping out, waiting for this once a year opportunity. And I volunteered again in the medical tent. And it was interesting this year, just my own observation, not as busy as a few years ago. And so I asked the other docs, said, what's going on? Do you feel like it's not as busy this year? Have you been volunteering here continuously? And one of the docs, the volunteer physician, said to me, "Oh yeah, it's been less busy on the medical side ever since Kentucky expanded Medicaid." I said, "Well, what do you think that is? Were Kentuckians coming here? Virginians went to Kentucky? What happened?" I said, "I don't know, but it's just not been as busy. People are getting the care that they need. But dental's still very busy." So it was very interesting and eye-opening to me to see that comparison in just a few years. But it's something that, again, I had never seen. I have done some medical missions abroad, and I've worked in the ER in different hospital settings. But seeing this in our state, my home state, our state of Virginia, was just very striking. It's something that I've never forgotten, and I think about always as we work day to day on implementing Medicaid expansion. And if for those of you who might be from the northern parts of the state, like I grew up in Fairfax, if you ever wondered, well, does that happen in other parts of the state? Absolutely. Even in Arlington County, which is, of course, a very rich county, not just in Virginia, but in the country, there are a lot of folks who are really in need of health care who don't have insurance. And this is just a picture taken from what's called the Arlington Free Clinic Lottery Day. So I used to work at Virginia Hospital Center in Arlington and volunteered at this free clinic. And the way people would get care there is they would register to be seen, and there were only a limited number of spots. And every month, once a month, people would line up and they would draw names by lottery out of a hat, essentially, to determine who got to have care. And it was only a fraction of the folks who got to be seen. And you see families, you see young people, you see people that, the people who I treated there, the vast majority of them were working. They were working as house cleaners. They were working in landscaping, construction, and other jobs where they just did not have access to affordable coverage. And this was what we could offer them in one of the richest counties in the country, a lottery. So why is that? Why is it that, well, we have the Medicaid program, isn't that for people who are low income to help them out? Well, in Virginia right now, and this is about to change, but right now our eligibility rules, which I know many of you know very well, probably better than I do, are extremely strict. And this is something I show this slide a lot because I want people to focus on what this really means. What are we talking about when we say 400,000, an expansion of coverage that's historical? We have to think about sort of what our current state is. What's our baseline? Well, this is our baseline right now. So in order to be eligible for Medicaid coverage, you have to meet two criteria in general, two broad criteria. So first of all, you have to be low income, right? Now, the thing is in Virginia, you have to be very low income. So what does that mean? For a parent, for example, in a family of three, you can see here that the ceiling for income is about $7,000 a year. That's a parent in a family of three. So if that parent who's making, say $12,000 a year were to apply for Medicaid coverage, we would say to them, "I'm sorry, you can't be covered because you make too much." which is ridiculous. You make too much, you're making $12,000 a year, and you have a family of 3. So that's our cutoff right now for parents. Now, but the other criteria is that not only do you have to be low income, you have to fall into certain categories of care, right? So if you don't meet one of these categories, if you're not a child, a pregnant woman, have a disability, or a parent, so essentially if you are an adult with no children or dependents, it doesn't matter how low income you are, you cannot qualify for Medicaid right now.